We're going to begin this morning with the very latest on COVID-19 in this country and the startling spike in cases we're seeing in both Ontario and Quebec. The two provinces reporting numbers yesterday not seen in some 5 months. Quebec, first of all, nearly 900, following almost 700 on Saturday. And the number yesterday, the province's highest daily total since May the 7th. Ontario fell just short of 500 cases yesterday, its worst day since May the 2nd. Overall, Sunday was the 10th straight day of more than 1,000 cases across Canada, with more than 9,000 identified in the last week alone. With those numbers, starting our conversation with Laura McQuillan, watching both provinces. Starting in Quebec, Laura, two of the major regions in that province are just about to be upgraded to the highest alert level.
That's right, Heather. Montreal and Quebec City is set to enter what's called the red zone, which will likely see some prohibitions on non-essential activities. But we are waiting for details out of the provincial government, and we do expect to get those this afternoon. So we'll keep you posted on what is going to be happening there. But as you mentioned, that does come as cases in that province spike. And in recent weeks, we've seen the provincial government in Quebec putting the onus for bringing down the number of cases on the public, telling Quebecers avoid gatherings, keep your distance, but now admitting those measures have not gone far enough, prompting this intervention. But something we heard last hour from Dr. Christopher Labos, who is an expert in these things, is don't expect to see an immediate drop in those high numbers, because people, once they get infected, have to go get tested, wait for the results. But although there will be a lag, he says it will make a real difference. Here's some more of what he told us.
We will start to see an effect, but it will take time. So we need to be consistent in our actions. But yes, we can still change the direction of this pandemic. The virus can only spread if we come into close contact with each other. So if we keep our distance and limit those contacts, the virus cannot spread as quickly and the numbers will plateau. And, there's no reason why we can't get this thing under control within the course of a few weeks to maybe a couple of months.
But right now as well, we are watching a couple of outbreaks at long-term care homes in Quebec. You'll remember back in the spring, several care homes there were really hard hit by the virus. Many deaths. Well, now we're learning that in Laval, one care home there has 11 residents, 7 staff who've tested positive, visits suspended while others get tested. In Gatineau, another long-term care home has 10 people infected. They are said to all be asymptomatic and doing well, isolated in the facility. And meanwhile, we're keeping an eye on Residence Heron in Montreal. That is where 38 people died back in the spring, really hard hit by the virus. We learned at the weekend that a staff member there has now tested positive for COVID-19. That sent residents back into isolation. They're all being tested, as are staff who came into contact with that infected worker. But health officials and Dr. Labos, who we just heard from, reiterating that message that while the numbers that are going up at the moment do appear to mostly be young people who might not be as badly affected by COVID-19, they do pass it on to others, older people, people more at risk, and that's why measures need to be taken like those that we are expecting to see out of Quebec officials later today, Heather.
So from Quebec to Ontario, Laura, next, that province also seeing an upward trend in its numbers, and we're hearing from some experts that the second wave could peak next month, really just in a matter of weeks. So what's the latest on Ontario's situation? Yeah,
ringing the warning bell here with some new modelling. They have 4 scenarios that they've mapped out on what could happen in Ontario, and it looks like from that modelling that the province's peak mid-next month would be more than 1,000 cases a day. As we were telling you just before, it's currently around 500. That is unless stricter public health measures can slow the spread. That would force hospitals to make some really tough choices about who gets their intensive care beds. We spoke to one of the members of that research team doing that modelling. Here's what she told us.
The really high-risk cancer surgeries, for instance, won't be able to go ahead if the ICUs are overwhelmed with people who are showing up in the emergency department dying of COVID-19 associated pneumonia and respiratory failure.
So a warning there of the risks that Ontario is running. We have seen some more restrictions put in place in recent days, recent weeks. Gathering sizes limited, bars and restaurants told they have to close earlier, and all strip clubs in Ontario shut as well. But the message being from those researchers, scientists and physicians behind that modelling, saying if more steps aren't taken to rein this in, we could see a much worse scenario. So they're urging once again officials to take more steps there, Heather.
Laura McQuillan, thank you very much.